there are a lot of exciting areas right now for the eye and outside the eye. Okay. The field has gotten a lot more sophisticated in the last 10 to 20 years in producing cell types of relevance and to produce them at very high purities and to characterize both the functionality and the various phenotypic properties of those cells, the genomic phenotypic properties of those cells. So we can make all different kinds of cell types. I think another areas that we talked about is the manufacturing technologies are getting better and better and better and becoming more and more scalable. And we're getting the resources starting to take interest in this particular field, especially with some of the successes, for instance, outside the retinal space, looking at CAR T cells, but also inside the eye space, with what was happening with Spark Therapeutics. So I think that these therapies, there's more and more people focusing in on these kinds of therapies. I think one of the exciting areas is that, for us is, I've told you about this little implant, which has these parallel membrane with the RPE cells on top of it. Well, that's a platform. That's a platform for potentially building the other layers of the retina. You could put photoreceptors on it. You could put all of the retinal progenitors on top of it, and looking at building the different layers of the retina so that you can replace more than just the RPE cells, that you can replace other parts of the eye, for instance, again, photoreceptors that are degenerating in patients with even more advanced disease or other types of retinal diseases. So, and I see this applying for a lot of different groups with other indications, looking at not only just building cell-based therapies right now, but rebuilding tissues. And, for the kidney, for the lungs. So I think that that's where the field is going. It's an exciting time right now. And that's, where the technology, I think, will be going.